We brought you in to interview for our clinic, registered nurse in our clinic. You want us to start out, I guess, by telling us a little bit about yourself?
Well, I went to college at SDSU, and I got my bachelor degree in nursing. Well, it's science nursing, but
Yeah.
And then in the summer while I went to school, I did a couple internships, and I did my first internship in Sioux Falls through Avera, and I just did like hands-on stuff and kind of shadowed a couple nurses and here and there. And then the next one, they actually let me do stuff. I shadowed here at St. Mary's. Yep, and I was in more of the labor delivery area because I was with the
OB area.
Yep, with like the brand new babies and all that stuff.
Oh.
Yep.
Were you around for all those New Year's Eve babies then?
No, I was just here in the summer.
Okay, gotcha.
Kind of a fun place to be in.
Yeah.
What do you consider your greatest strengths?
I think I take direction very well. I'm very punctual on time. I can be the leader. I can teach other people how to do stuff.
Okay.
But I'd rather just learn hands-on too from someone teaching me, and then I'd be able to explain it to someone else better.
Okay. Kind of like hands-on.
Yeah.
Suppose you enjoy your internships.
Yeah.
The classes. That's kind of. Okay. Do you have any weaknesses then on the flip side of things?
I do well under pressure, but sometimes I can get stressed out really fast and not know what to do.
Okay.
But I think that'll get better as I go on.
Something to work
Yeah.
on.
Good experience. Okay.
Social media, do you use any social medias like Facebook or Twitter?
Yes, I do.
Are you a tweeter?
I don't tweet that much. I usually just look at the news and
Yeah.
stuff, keep updated.
But if we looked at any of your tweets or Facebook, would we have any concerns about it?
Nope. Can't look at it.
So what kind of computer skills that you have? Most of what we do, we have to document on the
Yep,
computer.
I'm really good
What
at. I took a few classes with entering data into
Okay.
systems.
Data
and-
entry.
So
Yep.
you've got some data entry
Mhm.
experience, okay.
Yeah, nowadays, the nursing job, everything that you go in there before the doctor and you're typing all this stuff out.
Like the
Your
receptionist
typing
and
skills
stuff.
pretty efficient?
Yep. Yep.
Okay.
Couple other questions I've had.
Being a nurse, do you ever have a difficult situation where you had to step it up and some emergency or something, do you remember?
Well, sometimes they had to make certain decisions, whether what antibiotic to give someone right away because
Okay.
they didn't know to stop it. Or
Right.
They just sometimes you have to know your medicines and stuff because you could do the wrong one and it could get to worse. Yeah, you just have to know a lot to know before they really put you out there.
Have you ever had an experience where you had to handle, say, difficult patients?
There's multiple difficult patients. You just have to work with them and tell them you're understanding them and just be patient with them because if you're not, then they're just gonna get upset. But
What do you think one of the most important qualities you have that makes you
I think you need to be pretty patient and understanding. You can't just go in there and you just try to get through patients really fast. You get to know them and understand what they're going through or what they need help with.
And where do you see yourself 10 years from now? Do you feel like here is the place you want to be, or do you...
I'd like to move somewhere else, maybe a bigger city, but not really big. Maybe outside of the cities in Minnesota, outside of their area, a rural area. But
How long would you plan on? Would you stay in this area? do you think?
if I got a good job and I had a family there, I'd probably stay around that area.
Is most of your experience coming at this point from internships that you've had?
Yep, most of it is. Yep, I learned most of it's from those 2 internships.
Of all the things you do in nursing, what's the thing you most dislike about what you have to do in nursing?
Probably it's sometimes you do have the bad patients, or you have to do stuff you don't really want to do. There's jobs you being with the babies or
Yeah.
exciting perks, but then there's sometimes you get the not very
Right.
good jobs.
Right.
Get the
Like
rookie
to do
job.
things.
Yeah, you have to work your way up.
Right.
So-
Yeah. Have you ever had a situation where you maybe disagreed with a colleague on patient?
I haven't, but I like know what you mean. Like when you've seen like the other person knows exactly what's going on, and they have to like figure out a way to make the other person understand that they're right and they know what they're gonna do. But you just have to like talk it out otherwise.
And growing up, you want to, all the things that you want to do in your life. Is there anybody that you met along the way that really inspired you to be the person you are and helped you become the person you are?
My parents pretty much like the way they raised me, like taught me how to treat others and like what you should do and what you shouldn't do. So it's pretty much them, or like my grandma and my grandparents. They like how they raised my mom. Like then she knew how to raise me and teach me like what to do and what not to do.
Okay. So,
In this particular job, there will be opportunities to train others or to kind of mentor others. How comfortable are you in that role?
Yep. If I got really comfortable with like how they trained me and I understood everything, I'd like to.
You enjoy that leadership
like,
opportunity?
Yep, to show them what to do and explain things to them well. If only if I understood
If you feel
it, yeah.
knowledgeable enough
Yeah.
to do so, okay.
so do you have any questions for us anything about the job or anything that you have that we haven't answered?
Not really. I think you covered most of it. Yeah.
All right, no, that's about it for me. Very nice to meet you.
Nice to meet you too.
Very good.
Nice to meet you.
Brenna.
Brenna Longman is applying for a clinic registered nurse with a Vera Medical Group here in Pier. And first impression, Brenna was really good. You came in on time, appeared very confident and pleasant to be around.
Yeah, your personality, you just have an outstanding personality and friendly, and you just smile when you talk. And that's a good characteristic, so.
Yeah, you seem just there. We kind of dwell on personality here, but that's important when you're working with patients and patient care and families. And so I think that'll be a strength for you if this is truly what you're interested in going into some days or someday down the line. You seemed prepared to answer all the questions that we had. We didn't see any real noticeable pauses, I guess.
No.
The only place that you paused or didn't really have anything for us is when we asked you if you had any questions for us. And that's really the only
And it's
thing, I
important
guess.
that you do get some questions. It
Yeah.
could be anything about, do you have a fitness center close by where I really like to train and I like to go there before work, and is there something like that? Anything that would make us think that you're really interested in this job?
Yeah, we had one young person ask about ratio of patient to nursing care,
Yeah,
or
which was good.
additional training that you maybe
Right.
received to kind of update your skills. Maybe that's something that's important to you and you're wondering what kind of yearly training that they might provide or you might have access to keep your self abreast to new skills or new techniques and those kinds of things. Anything that would show interest in locating in our community or locating in our facility in the hospital there or the clinic in this particular case.
Maybe what does the clinic have here that would make me a better employee, and what training do you have so I can continue my education? I'm really excited about learning, and just any questions at all would have been appropriate.
Yeah.
But come up with something that's.
It just shows your true desire that you're really strongly thinking about working for us. And hopefully, if that is the case, that you have some questions.
But I would hire you in a second. I would take a look at your resume though, and put dates in your resume. You had some dates, and you didn't tell when you graduated from high school, the date that you graduated. Put your high school stuff in too for education, because we want you to know that you got a diploma, and it wasn't not that a GED would be bad. It's very good that you put 3.8 on your honors with SDSU, and I'm sure your Riggs High School probably had some honors too for you. So get that stuff in there, and the dates appropriate to that. So.
Yeah. Also, any template extras like the S-Peer that it puts on the end of your name, you can take those out. Those don't need to stay. as you
Yeah.
do yours. I did like the fact that you know, right up front, you put your skills and qualifications. I think that's a good thing.
Very well. Yep.
Otherwise, I think, well done.
And objective, seeking a full-time position as a registered nurse, maybe add on so I can help those who need help most, or whatever, put some little touching thing on, but that's good too. I'm just, everything, like I said, I'd hire you, in a second, so you did a
Absolutely.
very nice
Good
job.
job. Good
So-
job.
And the only thing that we mentioned is those questions, but besides that, perfect. So, very nice job, man.